Have you ever wondered what your doctor really thinks when you walk into their office? Maybe you've noticed a fleeting glance, a rushed response, or a feeling that your health concerns weren't taken seriously. Behind those polite smiles and professional tones, some doctors hold unspoken thoughts about older patients, thoughts that can quietly shape the care you receive. It's not a pleasant thing to consider, but the truth is, these perspectives can influence how your doctor listens to you, plans your treatment, or even decides whether you're offered the best possible options. In this video, we're diving into 5 surprising truths that might shock you or even make you a little uncomfortable. But they'll also empower you to walk into your next doctor's appointment with greater confidence. This isn't about making you lose trust in your doctor. It's about equipping you with the knowledge and strength to ensure your health and dignity are respected. Stick with me until the end, because the final truth could completely change how you prepare for your next medical visit. Now let's jump into the first truth. Truth number 1, assuming symptoms are just due to aging. Did you know that some doctors might quickly dismiss your health complaints simply because they think they're normal for your age? This is a troubling reality that many older adults face. Some doctors tend to chalk up symptoms like joint pain, fatigue, or occasional forgetfulness as the natural result of growing older. But the truth is, not every health issue can be explained away so simply. When doctors rush to label every complaint as aging, they may overlook serious conditions that are entirely treatable, leaving you to suffer longer or even face more severe consequences. This bias isn't just a shortcut in diagnosis, it can lead to serious mistakes. A fleeting chest pain might be brushed off as normal for your age, instead of being investigated for heart disease. Persistent fatigue could be dismissed as just slowing down when it might signal anemia, a thyroid disorder, or even early-stage cancer. When doctors assume age is the cause, the urgency to dig deeper often fades and opportunities for timely intervention slip away. This doesn't always come from bad intentions. Time pressures in busy medical settings can push doctors to opt for the simplest explanation. But simple isn't always accurate. Let me share Susan's story, a 78-year-old woman who loved her daily walks in the park near her home. When Susan started feeling short of breath and more tired than usual, she visited her doctor. The first doctor simply said, "At your age, this is normal. Just rest more." Susan trusted the advice, but her condition worsened. After months of struggling, unable to bear it any longer, she sought a second opinion. This time, the doctor ordered lung tests and discovered Susan had early-stage chronic obstructive pulmonary disease. With a tailored treatment plan, including medication and breathing exercises, Susan regained her energy and returned to her beloved walks. She often says she wishes she'd pushed for more thorough testing from the start instead of accepting that it was just aging. So what can you do to avoid this situation? Don't accept it's just your age as an explanation without further investigation. Prepare for your appointment by writing down a list of your symptoms, including how often they occur and how severe they are. Ask your doctor specific questions like, are there tests to rule out other causes? Or, could this symptom be linked to a specific condition? If you feel your doctor isn't taking you seriously, don't hesitate to seek a second opinion. Your health at 70, 80, or beyond is just as important as it was when you were younger. You deserve care that's thorough and dedicated, and that starts with speaking up to demand that your doctor explores every possibility, not just blames your age. Remember, your body might be trying to tell you something important, and you have the right to demand it's heard. Truth number 2, assuming older adults are less likely to follow treatment plans. Have you ever felt like your doctor glossed over treatment details as if they assumed you couldn't keep up or wouldn't bother trying? This is another unfortunate truth many older adults face. Some doctors believe that older patients can't or won't follow complex treatment plans, leading them to simplify care plans or even skip the best options because they think you'll find them too difficult. As a result, you might receive a care plan that's less than ideal, limiting your chances to improve your health and quality of life. This bias often stems from inaccurate assumptions about older adults' memory, hearing, or ability to manage multiple medications. For example, a doctor might think, if I prescribe this medication, they'll forget to take it. Or if I suggest a new therapy, they'll find it too much hassle. But the reality is, many people in their 70s and 80s are perfectly capable of managing detailed instructions, using technology like phone apps for medication reminders, or even researching their health conditions to make informed decisions. When doctors hold back information or don't offer the full range of treatment options, they unintentionally strip you of your right to choose what's best for you. Picture John, a 75-year-old man passionate about gardening and tending to his plants. When John started experiencing severe joint pain, especially in his knees, he visited his doctor hoping to find relief and keep up his hobby. But the first doctor just prescribed a painkiller and said, "At your age, the goal is to stay comfortable. Don't overdo it." John was frustrated. He didn't just want to be comfortable, he wanted to keep kneeling to plant and care for his garden. Unwilling to settle, John sought another doctor. This doctor took the time to explain a physical therapy program combined with a new anti-inflammatory medication. Together, they built a plan to strengthen and improve flexibility in John's knees. After a few months of dedication, John was back in his garden, planting his favorite flowers without pain. He says switching doctors helped him reclaim his joy in life. How can you break through this bias? Show your doctor you're an active and capable patient. Before each appointment, bring a notebook to jot down instructions or ask for written materials. Don't hesitate to ask about all available treatment options, even those that sound complex. You could say, "I want to know every possible way to improve my health," or "Is this treatment complicated? I'm ready to follow it with clear guidance." If you use technology, mention that you can use apps to remind you of medications or track your health. By demonstrating your commitment and capability, you'll encourage your doctor to provide fuller options, opening the door to treatments that could transform your life. Most importantly, remember that your ability to follow treatment isn't about your age. It's about your determination, support, and clear communication. You have the right to be treated as an individual with unique goals and abilities, not just a number on an age chart. When you show your resolve, your doctor is more likely to work with you to create a care plan that fits, helping you live healthier, more active, and more fulfilled. Trust that you can take charge of your health, because you absolutely can. Truth number 3, prioritizing younger patients. Did you know that in some cases, doctors may unintentionally dedicate more time and resources to younger patients, even though you deserve the same level of care? This is an uncomfortable but not uncommon reality in busy medical settings. Some doctors, often without realizing it, tend to prioritize younger patients, especially when time or resources are limited. They might think a younger person has more years ahead to benefit from tests, surgeries, or follow-up visits, which can result in older adults receiving less attention. This isn't always intentional, but it can mean you're overlooked for treatments or opportunities that could significantly improve your quality of life. This bias often surfaces in high-pressure situations, like crowded hospitals or clinics with packed schedules. For example, a doctor might spend more time explaining treatment options to a 40-year-old patient while offering only basic guidance to a 75-year-old with the same symptoms. Or they might hesitate to recommend a surgical procedure for an older adult, assuming recovery will be tough without asking if you're willing to take on the challenge. The problem is that this mindset overlooks the immense value of improving quality of life at any age. An 80-year-old deserves the chance to feel strong, active, and fulfilled just as much as a 40-year-old. Your health and daily joys, whether it's walking with friends, playing with grandkids, or gardening, are important and worth caring for. Think of Margaret, an 80-year-old woman who loved hiking with her close-knit group of friends. When Margaret started experiencing severe hip pain, she visited her doctor to find a solution. But her first doctor only prescribed painkillers and said, "At your age, hip replacement surgery might be too risky. You should limit your activity." Margaret felt frustrated. She didn't want to give up her hikes, which were her source of joy and social connection. Unwilling to accept that answer, she sought out another surgeon. This doctor evaluated Margaret's overall health, not just her age, and agreed she was fit for surgery. After a hip replacement and a carefully designed recovery program, Margaret was back on the trails, even leading her group on a short hike that spring. She says seeking a second opinion gave her not just her health, but her joy in life back. How can you ensure you're not overlooked due to this bias? Communicate clearly with your doctor about your health goals. If you want to stay active, whether it's walking, gardening, or playing with your grandkids, make that clear. You could ask, will this treatment help me keep doing the activities I love? Or are there other options so I can keep living the way I want? If you feel your doctor isn't taking your needs seriously, don't hesitate to seek a second opinion. A good doctor will assess you based on your overall health and personal desires, not just your birth year. Remember, your time, comfort, and joy in life matter. By speaking up and demanding fair care, you can change how your doctor sees you, ensuring you get the attention and opportunities you deserve. If you're still watching this video and finding this information helpful, please leave a comment with the number 3 below to let me know you're still with me. What do you think about doctors sometimes prioritizing younger patients? Share your thoughts. I'd love to hear your story. Truth number 4. Downplaying the life goals of older adults. Have you ever felt like your doctor didn't really care about your big dreams or personal plans, like traveling, pursuing a hobby, or simply living life to the fullest? Another unfortunate truth is that some doctors, often unconsciously, assume that when you reach your 70s or 80s, your priorities are limited to staying comfortable or maintaining basic health. They may not realize you still have vibrant goals like hiking, gardening, or even taking a dream trip. This bias can quietly influence the advice and treatments they offer, causing you to miss out on opportunities to live the life you want. When doctors assume you're only focused on comfort, they might lean toward short-term solutions, like prescribing painkillers, instead of exploring more proactive treatments, such as surgery or physical therapy, to help you achieve your personal goals. For example, if you mention knee pain, a doctor might suggest medication rather than discussing options to get you back to gardening or dancing. Or they might avoid mentioning a new therapy, thinking you wouldn't want the hassle of extra steps. This mindset is especially limiting if you have clear, inspiring goals, like joining a yoga class, traveling with family, or simply staying independent. These goals aren't just important, they're the driving force behind living healthier and happier. I once heard about William, an 82-year-old man passionate about playing golf with his friends every week. When William started feeling severe knee pain, he visited his doctor, hoping to find a way to keep up his hobby. But the first doctor only prescribed painkillers and advised him to rest more and avoid golf. William felt like his life's goals were being dismissed. Golf wasn't just an activity, it was how he stayed connected and found joy. Unsatisfied, William sought another doctor, who suggested a specialized physical therapy program to strengthen his knees, paired with an anti-inflammatory medication. With this support, William was back on the golf course in just a few months, even hitting an impressive shot his friends still talk about. He says sharing his goals clearly with his doctor made all the difference. How can you make sure your goals are taken seriously? Actively share your dreams and plans with your doctor. Whether it's continuing to garden, traveling to see your grandkids, or joining a community club, make it clear. You could ask, what treatment can help me keep gardening, which I love? Or, is there a way to ensure I'm healthy enough for my upcoming trip? By sharing your goals, you show your doctor you're not just a patient needing to stay stable, but someone with a rich life and ambitions worth supporting. If your doctor doesn't ask about what you want to achieve, bring it up yourself. These goals are what drive you to live better, and your doctor needs to know to create a care plan that fits. Remember, your dreams, big or small, matter, and your medical care should help make them a reality. Truth number 5, underestimating the emotional impact of aging. Have you ever felt like your doctor only focuses on physical symptoms without asking how you're doing emotionally? One critical but often overlooked truth is that some doctors don't pay enough attention to the mental health of older adults, like feelings of loneliness, grief, or anxiety, even though these can significantly affect your overall health. Aging isn't just about the body, joint pain, blood pressure, or test results. It's also about navigating big changes, like losing loved ones, reduced independence, or worries about the future. When doctors overlook the emotional side, your treatment plan may fall short, leaving important needs unaddressed. Mental health directly impacts physical health. Loneliness can disrupt sleep, reduce appetite, or weaken your immune system. Prolonged sadness or anxiety can make you less active, affecting your recovery from illness. Yet some doctors may dismiss these feelings as normal for aging without suggesting solutions, like counseling or support groups. They might not ask about your life beyond physical symptoms because it's not on their standard checklist. But if you don't share, they might assume you're fine when you respond, "I'm okay," to a casual question. As a result, you may feel unheard and your health could suffer without anyone realizing. Let me tell you about Dorothy, a 79-year-old woman who was once very active in her neighborhood book club. After losing her longtime best friend, Dorothy started feeling depressed and constantly tired. She visited her doctor, hoping to find the cause of her fatigue, but the doctor only adjusted her blood pressure medication and said, "At your age, feeling sluggish is normal." Dorothy felt unheard, as her issue wasn't just physical. Fortunately, a neighbor suggested she join a counseling group. Through those sessions, Dorothy realized her grief over her friend's loss was heavily impacting her health. With support from counseling and small lifestyle changes, like rejoining her book club, Dorothy gradually regained her energy and joy in life. She says sharing her emotions helped her feel seen as a person, not just a patient. How can you ensure your mental health gets the attention it deserves? Be open about your emotions with your doctor, even if you think they're unrelated to physical issues. If you're feeling lonely, sad, or anxious, say so. It's not complaining, it's providing vital information for a complete picture of your health. You could say, "I've been feeling lonely lately. Could this affect my health?" Or, "I'm worried about losing my independence. Is there a way to support me?" If your doctor isn't trained in mental health, ask for a referral to a counselor or support group. Also consider joining community activities like a book club, yoga class, or volunteer group to stay socially connected. Your mental and physical health are deeply linked, and a good doctor will understand that caring for both is key to living well and fully. Don't hesitate to speak up. Your emotions deserve to be heard. Hearing these truths might stir up a range of emotions. Maybe you're nodding in agreement because you've experienced them, or perhaps you feel angry, hurt, or even inspired to take action. But the most important thing I want you to take away is this: your health, dignity, and dreams don't lose value just because you're older. Your experiences, wisdom, and desire to live fully are precious assets no medical test can measure. You deserve care that's respectful and dedicated, and that starts with you speaking up, asking questions, and actively engaging in your health journey. The truths we've explored today, from doctors attributing symptoms to aging, assuming you can't follow treatment plans, prioritizing younger patients, downplaying your goals to overlooking the emotional impact of aging, aren't meant to make you lose trust, but to empower you to walk into your doctor's office with confidence and knowledge. Bring a notebook to jot down notes, ask specific questions, and don't be afraid to seek a second opinion if you feel unheard. You're not just a patient, you're an individual with stories, goals, and the right to live healthily. When you work as a team with your doctor, clearly sharing your desires and emotions, you open the door to treatments that help you not just live longer, but live better. Take this lesson to your next medical appointment. Don't let age define you. Let your wisdom, determination, and dreams guide the way. You deserve to be cared for as a whole person with everything that makes you, you. Thank you for taking the time to watch this video. If you found this content helpful, please hit the like button, share it, and subscribe to our channel. And don't forget to turn on notifications so you won't miss our next videos. Please leave a comment below and share one lesson you took away from this video or how you plan to use it to improve your health. Your thoughts mean so much to us. And if you have suggestions for how we can improve our future videos, let us know. We're always eager to bring you better content. Always remember that age is just a number. Your health, dreams, and values shine as brightly as ever, and you deserve care that helps you live fully every day.